Good afternoon, I'm Jill Valley. Montana Governor Steve Bullock holding a news conference right now to provide updates on Montana's response to COVID-19. Let's go now to Helena for more.
It's an interim analysis of COVID-19 cases in Montana as of 4/10, last Friday. It's been prepared by the epidemiologists of the Communicable Disease Bureau at the Montana Department of Public Health and Human Services. What the report did is it analyzed diagnosed cases of COVID-19 in Montana through last Friday. It sheds light a little bit on who this virus impacts, how it spreads, and patient outcomes. I want to thank our local public health officials across the state who diligently investigated cases of COVID-19 and reported that information to our state epidemiologists. It'll help the state continue to make data-driven decisions to aggressively respond to COVID-19 in Montana. Remember, Montana had our first COVID-19 case on March 11th, and that was actually an out-of-stater. It was a Montanan in Maryland at the time. 3 days later, we had our first 4 cases on March 14th, and since then the number of new cases have climbed to 399 as of today. It took 13 days to reach 100 cases. After that first 100 cases, growth had remained steady and increasing by about another 100 cases every 5 days. An even slower rate of growth has been detected from our most recent case reports. And although it's too soon to tell if this slow growth will continue, the report offers early signs and measures to slow the spread, including social distancing and staying at home, are indeed working. In the last 2 weeks, the laboratory processed an average of 370 specimens daily, reaching an average positivity rate of 4.5%. And while we know that this virus can be especially dangerous for our older Montanans, analysis of demographics show that 20 to 29-year-olds make up 20% of our cases. And the second most common age group are those between 50 and 59 at 17%. Median age for all cases in Montana is 48 years of age, and half of our cases are between 31 and 62. Of Montana's total cases, 50% are male and 50% are female. Of 86% of the cases with known race, 94.4% of persons identified as white and 3.7% as Native American. Other cases identify as 0.3% African American, 0.4% Asian, 0.3% Hispanic, 0.3% Hawaiian, and 0.6% other race. Native Americans are not disproportionately impacted by COVID-19 in Montana at this time. You'll see in the report that travel-related cases contributed to the majority of the cases early in that outbreak, but new cases attributed to travel are declining in Montana in a relative sense. Of those cases where we've actually identified, been able to kind of track back, recognize that about 70% of them are between community-acquired transmission, clusters, and contact to either a family member or known COVID-positive person. Contact and cluster investigations have increasingly added to these counts, indicating that disease control efforts through local public health staff is identifying those infected and isolating them appropriately. I know that many of you have had questions about what's been going on in Gallatin County. You'll see at the end of the report there's a couple-page appendix including some of the detailed information on COVID-19 cases there. We'll certainly make sure that you all receive a copy of the report. Hope you find it useful in your coverage of COVID-19 in Montana. We'll get that out soon. We hope to do a similar report, hopefully every week. This analysis, among other models and factors, are really important in guiding both public health and emergency response experts as we engage in discussions on what our future actions and our future responses to this virus will look like. We did get an early start in preparing and responding in Montana. We're taking the right steps at the right time to slow the spread of this virus. Staying at home now and doing the social distancing will help us to take steps to reopen back up sooner rather than later to rebuild a thriving economy. And look, I want to open up things, get back to a normalcy as much as any Montanan in the state. And I know that Montanans are hurting, and especially financially. But I also don't want to put us in a worse position than we already find ourselves in trying to get a hold of this virus. Compared to surrounding states that took lesser actions, we have a significantly lower rate of infection per capita. South Dakota has a rate per capita of about 3 times what Montana does. Or Florida, which took some of the social distancing measures much after we did, 2.5 times the rate per capita than we do in Montana. While we have been able to slow that transmission, we're still incredibly susceptible to contracting it. And not only contracting it, getting dangerously ill. We have to have a healthy population to have a healthy economy. And let me be clear, this is a dynamic time. Think about it, it was a month and a day ago, that we got our first cases, and we had closed down schools on a statewide directive. And it's dynamic, and I am in regular consultation with public health officials about the trends we're seeing in Montana. And I know it's frustrating that we can't give a date certain when things will get to some degree of normal again. The decisions are going to be guided by the ongoing data and the science, not politics. At this time, the closure directives are extending through April 24th. And picking a date to say right now when everything will expire certainly doesn't seem sensible when we think about the health of Montanans and the health of our economy. The measures we've been taking so far are exactly doing what we had hoped for. And we are slowing the spread. We are protecting our aging population, which we do know are most vulnerable to this disease. And I really do thank all Montanans for that. And I thank you for your patience. And I thank you for your continuing hope. I know that this is incredibly hard, but the data and the science does tell us that we need to continue these efforts at this time. While we don't know when, even when we do get to the point of starting to open things back up, it'll need to be a measured and calculated and gradual approach, because that's what will really allow our economy to get back on track. We can't just flip a switch. It's certainly important that our healthcare systems have the ability to ensure care for those who become sick with COVID-19 and other conditions as well. And we're also using this time, and we have been all along now, to make sure that's the case. There's other critical considerations to bear in mind, such as keeping our most vulnerable population safe, including those in our nursing homes and our long-term care facilities, and limiting those, what we'd say, super spreader situations, where one event could cause community spread all across a town or indeed the state. If we open up without going through extensive preparation and looking at the facts that we have in front of us, knowing that this is a dynamic and changing time, we could walk back all of the progress that we've made over this past month. And in the meantime, we'll continue to do everything we can to help provide economic stability to Montanans during this time. Department of Labor and Industry began paying the additional $600 unemployment insurance benefit established with the passage of the CARES Act. Montanans using direct deposit should expect to see those funds within 2 to 3 days, if not sooner. Claimants who receive checks should expect to see their benefits within the week. Let's recognize also what Herculean exercise this is. 32,000 benefit payments are being processed today to the tune of about $20 million that'll be going out to Montanans in the upcoming days. At this time, as we issue the funds, they're not being issued to that population under the CARES Act, which includes those that are self-employed. Our Department of Labor and Industry, it's working diligently to complete a review of the recently received, we just got the federal guidance, and implement sort of the IT changes to process claims for self-employed Montanans as soon as possible. Those steps are in addition to the state waiving the 1-week waiting period, waiving requirements that claimants search for a job during this time. Additionally, it might have been noted, yesterday I issued a directive to protect emergency rental assistance to provide emergency rental assistance to help families with limited financial resources make ends meet during the unprecedented economic situation that is COVID-19. Program will allow relief funds specifically for households with children eligible for the temporary assistance for needy families program. The state's also providing additional funding for families who are not TANF eligible and looking at both state and potentially federal relief money to do that. Again, I would like to thank Montanans for their diligence during this time. It is making a difference in these unprecedented and challenging times, and it's our continued efforts that will ensure that we have both a healthy population and a healthy economy in our state's future. I now love to open it up for questions. If you'd like to ask a question, press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. Grab real quick, pause 1 second. I think I left one thing in my rush out here in my office to grab. Hold on just 1 sec, sorry.
All right, the governor had to run to his office and get one more thing as he's talking to us about Montana and our response to the COVID-19 thing. He did say that he, at this point, has not extended those closures till April 24th. That still stands, but again, that could also depend on what he says. It's the science and the data. Let's go back to the governor. He's back from his office now.
Wondering if you have a formal letter from the state Republican saying some of your directives are unconstitutional.
One more time. Oh, do I have a formal comment on the directives are unconstitutional?
A letter from the Republican leaders in the state and the House asserting that your directives are unconstitutional.
Yeah, you know, first and foremost, I guess it's interesting in some respects that those same leaders just 2 weeks ago were praising the efforts. And I look at a column that said words to the effect of, as part of this broad-based collaborative effort to stop the spread of COVID-19, we encourage all Montanans to remain vigilant, observe public health advisories. As much as is still unknown about this virus, please be patient as state agency staff are working their hardest and using all available resources to bring about a resolution to our many challenges. So that those same officials were saying, let's work together and make sure that we do everything we can not to slow the spread of the virus. It's also curious 2 weeks ago that one of the things that they could point to, right, was that we haven't lost rural hospitals, and we've kept them strong. Now, in part, that's because of things like Medicaid expansion, which all of those leaders actually voted against. But it's disappointing at a time where we're asking all Montanans to come together and do the right thing so we don't become that next hotspot, so that every community doesn't have to face some of the challenges that we've seen around the country. And it certainly isn't a time to politicize these efforts. I want to get the economy going just like every Montanan does. But I want to do it in that way where we can make sure that the steps that we take today won't put us in a worse spot. And the efforts that we've taken, and every one of the directives and the efforts have been in a way where we've recognized that it impacts Montanans. We've recognized what it does, and I don't take any of those lightly. And certainly both make sure that it's consistent with the authorities I have, but also the best interest when it comes to the public health of our citizens and the long-term economic health of our state.
Yeah, Governor, this is Troy Shockley from the Montana Radio Company.
Hi, Troy.
Hi, I wanted to ask, there are governors on, I guess, both coasts now that are forming coalitions and saying we're going to work together to determine when it's safe and just how and how we sort of get these things running again. Is that something that you're considering and you're actively doing, is talking with other states and other governors along those same lines?
Yeah, Troy, yesterday, so there was an announcement of, I think, the 3 West Coast states saying that here are things that we'll consider, and we're going to open as one block and take steps one block. And much of that happened the same in the northeastern corner of our state. I mean, recognize that Montana is a state of 147,000 square miles. And actions that we've taken in Montana to slow the spread are at times even different than some of our neighboring states. So I have had discussions internally with individuals and experts of what steps are we going to have to take and can we take when we start thinking about a reopening. Now, it is a gradual, right, or dynamic, because literally every single day can change. I've also had consultations with other governors as to what they're thinking about, and we'll put that all together in an orderly fashion. But directly to the point of, like, am I reaching out to, and I've had great conversations with, you know, and I think the last group call with some of our neighbors was probably about a week ago. And we talk about everything from practices to, if it comes to that, trying to do a PPE collective and other things. But when looking at the factors of what we can do as we look to reopen, Montana's taken some, what I think are very important and significant steps to try to slow the spread. So we'll be certainly informed by what other states are doing, but working on it as we always do, kind of with those homegrown evidence-based solutions. Sir?
Governor, if you, as you said, you don't feel that it's practical at this time to start setting a date or something like that when we can begin to look at reopening measures. Are you at least able to point to something that perhaps you guys would be looking at as maybe this is some kind of a milestone or something that you'll be looking at when you make that determination, so people at least have a little idea of? Sure,
yeah. And let me be clear, I don't think that there's been any state in the country that has said, this is the date where things magically reopen. And I think we do look at the number of tests occurring, the number of positives along the way. Where are we trending? Yeah, we're not like we were the first week or so where we're having exponential growth. You look at actually, and we're in regular contact, surveying the overall healthcare community. Do you have what you need? Do we have the boots on the ground, too, for the contact tracing that could well be necessary along the way as you start to reopen when new little clusters or hotspots spread? Those are some of the factors, but that's all going to be sort of taking a look at it and saying, right now the directives are in place through April 24th. I've been doing a 2-week by 2-week because it is a rapidly dynamic and changing time. And certainly hope to have guidance, greater guidance as we get close to the April 24th. But I think we also have to see both what steps are we aggressively taking, how's this virus responding, and what steps can we take to start reopening things. But that's another thing that I guess I would underscore, and I think that most folks recognize this, that there's not going to be in a month or in 2 weeks where COVID-19 all of a sudden magically goes away. So even as we would start to look at what might be able to be done to reopen, things will look different. They will look different than they were before. Yes, ma'am.
Just to follow up from the first question, just kind of plain and simple, do you believe that your directives are unconstitutional, and does that change anything you're doing now or in the future?
Now, look, I've had a busy day like every day has, and at some point we'll respond to that letter, but all of the directives have been both consistent with the Constitution's design, state statutes, which the legislature is responsible for.
Governor, real quick. So with a couple weeks ago or last week, you touched on how 1,500 or 1,600 tests were coming into the state. Do we have a number on how many tests are coming in each day at this point?
So we've been able to keep two different, I guess a number of different things on that. We've been able to keep about an excess supply of about 1,500, and that's with one of the testing machines, the principal ones we've been running through the state public health. We're taking some efforts to stand up another machine, which actually was borrowed from another lab, which might even double our capacity for testing. We got 15 of these Abbott instant tests machines. Instant test meaning that you can't do a bulk test, but you can find out the results of an individual test within 5 to 15 minutes. We've pushed a couple of those out and are looking at the best way to deploy those as well. Notwithstanding the fact that we got the machines, but we didn't get adequate testing supplies for it. So from a test kit perspective, I have no concerns as of today, making sure that we have what we need to be testing every Montanan that is symptomatic. Is it at times daily, and it certainly is weekly, saying, do we have the reagents, the transport material, the stuff that you need to take the swab, assuming you have the swab, and get it tested? Yeah, it is. And that's something that we'll continue to be working on as well.
That's one question over.
Phone question.
Hey, Governor.
Hi, Holly.
Hey, so I got two questions. Of course, one thing I wanted to ask was in the letter from the Republican leadership, there was a suggestion of letting counties make the choice on rolling back some of the orders. You're recognizing that Bozeman has many more cases, looks differently than cities of Glendale. But we had that, and you chose to put in the statewide, go that direction. I'm wondering, what's the importance of having this be done at a statewide level versus having counties make those decisions? And then also wondering, as long as we're at a place where there's not a vaccine, reopening these things, you kind of touched on this, but it comes at a risk that people could get COVID-19 and possibly die as we start to kind of go back to whatever normal looks like. And I'm wondering sort of how you weigh that against looking at maybe trying to reopen things and see what some of the options might be.
So, yeah, it would be great if we had one of these up here, because I can't actually. One more, so the first question, I think, Holly, was the thought of opening up individual county by county or let the counties decide?
Yeah, and just wondering, we saw that at the very start of the counties were making those decisions on, closing places like bars, restaurants, just to go orders with those days, decisions statewide.
Sure, and gotcha. So look, every one of the directives have said that the state level is not going to be a local county can become more restrictive, not less. When it comes to then, do we open up individual counties or kick it back at some point so that every county can decide when and what they're going to open? That may end up at some point a possibility, or a partial, as we talked about, partial reopening. I mean, to your point, Gallatin County may be a lot slower than a whole lot of other places in relieving some of these. But we've also, even in the last in the last week, we've seen additional counties where they get their first COVID-19 positive. And we've also seen what can happen in a small community or county like Shelby in Toole County, where once you get a cluster and community spread, it can substantially, not overwhelm, but substantially impact that county or community. And it's also in many of our counties, I mean, it's not that uncommon for a hospital to have literally 1 or 2 ventilators. So we'll continue, it is, as I've said, it's a dynamic time. We'll continue to take a measured approach. And as we look at ways that we might be able to reopen facets of Montana or relieve people of some of those directives, part of that could well be geographically, rather than just statewide, it's all lifted. And your second question was?
I'll unmute her.
What's that? Please unmute her.
Oh, yeah, I'm back. It's recognizing that we're not vaccinated and the virus, it doesn't go away. How do you sort of balance the risk that people, we could have outbreaks, we could have people dying, it could come back and then you start to face things then. How do you sort of balance those two things? Because you desire to reopen your
Yeah. No, thanks, Holly. And that's why, one of the things that I said is even when things start to reopen, it might look a little bit different than it did before. I mean, you hear different things every single day, but I think I've heard 11 months to a year before there's any vaccine created. So this virus will still be around. And the only way to continue or completely eliminate all potential exposure and risk would be literally not even to be having this conference and all of us staying at home. So what we look at and what I look at is how do you mitigate that risk? And then also, to the extent you have COVID-19 positives, how could you rapidly respond thereafter? How could you try to mitigate the further spread along the way? I don't think until, and maybe even after we have a vaccine, we're ever going to be zero risk-free again, but it's balancing the risks to our overall healthcare system, to our economy even longer term, if we have huge flare-ups again. It's balancing those and then trying to take those measures that would be most protective going forward and most active or proactive in responding to any additional positive cases or outbreaks that could occur. Thank you.
All right, you've been listening to Governor Steve Bullock having another news conference regarding COVID-19 and Montana's response. He did talk a lot about a report that he's using that was presented by epidemiologists in Montana, talking about COVID-19, where it is, who's getting sick, how it's spreading, that type of thing. And it's that kind of science and data that he says he is using when talking about reopening our economy once more. He did not extend the deadline of April 24th for the stay-at-home order, the school closures, or the certain business closures. He did re-emphasize, though, that we have to have a healthy population before we have a healthy economy. So he can't give a date, certain time when we can reopen. It's going to depend on science like this epidemiology report. So whether or not that is extended is something we're not going to know until later. He doesn't want to walk back any progress, and he knows that the virus is not going to disappear once things start opening again, which again will probably be in stages. Some of the data that was interesting, the median age of those getting COVID-19 in Montana is 48. 20% of the cases are people 20 to 29 years old. 17% are 50 to 59 years old, and then the rest are older folks. 50-50, male or female. The majority of those getting sick are those who identify as Caucasian or white in Montana, but about 4% of our Native American population has had a test positive for the coronavirus. He did mention that as cases start to slow, it's showing that this social distancing and the stay-at-home order is working. And he says, why is it important to talk about the science? Because that is going to help him figure out the future. So I know a lot of people really want to know, when's the end game with all of this? The science is showing, they're looking at it, and they're trying to figure that out. We just don't know yet. We'll have a full recap of his news conference coming up at 5:30. So we'll see you back here then. Enjoy the rest of your Tuesday.
He said that it was actually that solid fiscal stewardship to meet some of the challenges of the public crisis, where sometimes I had partners and sometimes I didn't, as we ended up leaving $300 million in the bank, when we have a fire fund, when we have an emergency reserve. But when we're really talking about steps like it's true that from police officers or firefighters or other essential first responders, they continue to serve Montanans, they're exempt from a stay-at-home order. I wouldn't have it either any other way, and I would hope that they wouldn't either. And I think that the rest of the assertion is at least a little bit, untrue or insincere, in as much as you have large swaths of local and state government, including the very legislators who authored the letter, and their staff working remotely or at home like private sector employees. So we did the overall state of Montana. I mean, we were even slower to do working from home than the legislative branch was. And we wanted to do it in a way where we could make sure that the functions of government are not only maintained, but I think that if the hope is that it's sort of bizarre that what the request is, then that we would furlough all kinds of public servants at this time and put them into the unemployment insurance system. Another phone question.
Good afternoon, Governor. Chris Peterson, Honduras News. Is there any way you can really open up a place like Glacier National Park because of the crowds?
Yeah, and Chris, I wish that, I hearken back 4 weeks and 2 days ago when I initially issued the directive on closure of schools. And even at that time, there were some folks who said, no, we should not be doing this. I mean, I recognize that the world has changed a lot in 4 weeks, but that's where I also say that the world can change and will change a lot in the next 4 weeks and the 4 weeks thereafter. So the sort of absolutes that we would all love to have today on April 14th of knowing what things look like going forward, I don't think anyone in this country does. And what we have to do is try to take the best steps that we can along the way. So I sure as heck hope that there is some time this summer that I have the opportunity to take my family hiking in Glacier Park. I hope we get back to some sense of normalcy, or if not, at least a modified sense, meaning that even in Glacier Park, you're doing more social distancing along the way. But I think that that sort of certainty that we all want right now, or the answers right now, we just have to recognize how dynamic the last month is, and we have to be both patient, hopeful, and try to put as much into the next month and month thereafter as we have this past month.
Another phone question.
Another phone question.
Governor Bullock, Tom Schultz from Voices of Montana. I know that you're putting social distancing guidelines out there for businesses that are returning to work, so to speak. Are there, and I know it's uncharted territory, but are there any guidelines regarding their liabilities for consumer and workforce, given the fact that there's not going to be enough screening available? Is there any sort of advice for businesses regarding liability?
When we reopen things, or even today?
Well, the new normal going forward.
Well, that's, and once we get the whole new normal going forward, we'll try to put out specifics toward businesses and businesses reopening. But as of today, we haven't done that. And there's a question of liabilities for non-essential businesses and the like. That's one that would be more sorted out by the courts than the government.
Final phone question.
Final phone question? Is Phil Drake there? It's 5-star, Phil.
Not Phyllis.
All right.
Back to test. You said you have no concerns about my kids getting tested, but we do look now at these cases about them saying positive test constraints. Do you think those epilets should get tested, or do you just take less?
So the question was about testing constraints, and that Missoula County recently said that, I think it was yesterday, that we were going to go to epi-tracing, meaning that so you're in contact with somebody that's COVID-19 positive and you're symptomatic, that they'll count them as an epi-trace positive case rather than testing. And part of the concern is the overall testing supplies. And look, there's a lot that, as you know, we have at least, well, we have 56 county public health directors. But one of the things that I will continue to encourage is anybody that's symptomatic to be tested. And we'll do that, you know, not only through events like this with the press, but I'm having a call with Primary Care Association. I'm talking to many of the medical associations in the upcoming days, for the reasons of that the way that we'll really understand what's happening in a community and what's happening in our state is knowing the tests and knowing that if somebody is at all symptomatic, whether that's a positive test or not. And doubtless, unlike I haven't spoken to folks from Missoula County, no, I have concerns on a regular basis about supply of tests. But I want to do everything possible to ensure that we have the supply. I mean, we have not gone one day in the last month where all of a sudden our testing processing abilities have been overwhelmed. Meaning that, and our state lab's done a great job. We're 24 hours a day, literally, that all the tests that we get are processed within 24 hours or a little bit more. And by the same token, that had real concerns, and there still may be concerns about the swabs. Was on any number of calls about that. Concerns along the way about making sure that there are sufficient reagents and transport material. All continue to do, and not just me, but those at the state, everything we possibly can to ensure that the ability to test is there in communities large and small. And what we need is healthcare providers and others to, if someone is symptomatic, to do that test, because that's how we will better inform us all together. Now look, I look at spreadsheets of where are we relative to other states when it comes to testing. We're about dead in the middle as far as testing percent of our population or per capita. I love and continue to push our folks to say, how do we increase the testing capacity? And it's something that, as we're working on everything else too, we'll continue to work on that as well. So I think that was a longer, probably, response for the question that you asked, that counties and communities certainly can do epi-tracking, but I would encourage everyone that if it's positive to try to get tested. Yes, sir.
How do you try and explain to people the severity of this virus who don't understand it?
Yeah, and it's I mean, I had a chance late last week to go up to Toole County. And knowing that, first of all, it's enough sacrifice in an assisted living facility not to be able to have regular visitors. Because we've already taken steps for nursing homes. But to know that there's been losses of life. Or explain it in that, yeah, I've only spoken to my parents from a distance because my parents are in that position where if somehow that they contracted this disease, that it is so dangerous to them. It's no overstatement that for the 7 losses of life that we've had in Montana, which look relative to a large city, may seem small, but it's no overstatement that every one of those losses weighs heavy on me and as a state, as a community, because we really are. There's something, I think, forget the partisan games and stuff like that, that we really are a community where we care about our neighbors. That I try to explain that just like you care about that neighbor, that's what we're doing here. And it's hard, and it's difficult, and it is frustrating. It's frustrating for everybody out there. It's frustrating for me. It's frustrating for me not just as a public servant or as a governor, but as a parent, as a son, as somebody that has friends in business who are struggling right now. And that's many of the reasons why, you know, I've said to friends and others at times, I've said, I'm so over this. Meaning, I would so much rather be doing something else. But I say, I wish the virus was. I wish the virus was over this. And the steps that we've been taking in Montana, while difficult, are making a difference in losses of life, are making a difference in healthcare facilities not being overwhelmed, are making a difference in what we're seeing with rates of contagion. And just encourage people to, it's been hard for everyone over this month, but to recognize that we're doing it with the thought that the steps, which are difficult right now, will make it easier on the back end, easier to reopen in a way, easier to get this economy thriving as it should be. And so I guess that's both how I think about it and how at times I explain it. Well, thank you all very much.